Hey guys, hello and welcome to my YouTube channel. I hope that you are all doing great in your respective lives, be it your med school or in your dedicated phase for your USMLE Step 1. In this video, I'm just going to talk about an important topic which is among the mind of most of the Indian medical students and also the FMGs who are supposed to take the licensing exam in India. So before the introduction of NEXT, there was no such licensing examination in India. You just had to pass the final year, then you had to do the internship, and automatically, after doing the internship, you were given the license to practice medicine in India. But now they have introduced an licensing exam, and you have to pass that exam first, and then you will do the internship, and finally you will get the license. And even with that licensing examination, you will get a score, and that score will help you fetch the residency spot over here in India. So, there is a bit of dilemma among the students, like when should we start our USMLE preparation and how should we balance the next thing with the USMLE thing. So, in the coming few minutes, I will try to, answer as much as I can, or what I feel or I think if I had been in your place, what would I have done, in order to balance the next thing and the USMLE thing. So the next thing or the next exam you are supposed to take after your final year, and I will say that if you have to prepare for USMLE, in this video we are talking about the USMLE step 1. The USMLE step 2 is not in the question. If you have to prepare for the USMLE step 1, I will say that you have to be free from that step 1 in your final year, because I don't want that in your final year you should be just hopping between two things, next USMLE, so that you will not be able to do the both things at one time, because the syllabus is altogether different. While the next exam, it focus mainly on the clinical subjects like medicine, surgery, gynae ops, pediatrics, and ophthalmology and ENT, while the USMLE step 1, it focus primarily on your preclinical subjects like anatomy, physiology, pathology, pathophysiology, and biostats and stuff like that. So I will say that whenever you start your studying, be it your second year, be it your first year, be it your third year, but you have to keep the final year or the fourth year as it is whole for the dedicated next preparation. So I will say that in ideal scenario, you have to start your preparation by the beginning of the first year, sorry, by the beginning of the second year. Don't do much of experiments in your first year. It is just a transition phase from your high school to the med school, and I will say that be gentle during your first year. It is a transition phase, and I don't want many ups and downs in your first year. Just be gentle, acclimatize yourself with the med school, the different kind of books in your med school. And as you pass your first year and the moment you enter into your second year, it is the right time for you to start your preparation. And you have to start your preparation and keep in mind that these are the 2 years for me to give the USMLE step 1 and also balance the med school. So the second year and the third year, these are the two crucial years in which you have to prepare yourself for the USMLE, and also you have to take the USMLE by the end of your third year of med school, so that by the final year of your med school you are done with the USMLE step 1. Now you have to focus on the next thing, and you have to pass the next thing, so that you are you don't have that licensing question in your mind, and you are free, you are safe, you are free, and you are free to prepare for your USMLE step 2 in the internship. And in the internship you have to prepare for USMLE step 2, and also in your internship you can take the OET examination, so that by the end of your internship you are done with USMLE step 1, step 2, OET, and you are ready to apply for ECFMG certification. This is an ideal scenario. So the take home point are that start the preparation in second year, do nothing in first year, it is a transition year, and by the end of your third year you have to take the USMLE step 1, and by this you can focus, you can balance between the next and the USMLE thing. So thank you so much for watching this video. This was all in this video. I didn't talked much about the other topics, and I want you to be to the point and as clear as possible. And again, if you have questions, you can connect with me over the Instagram, and I'll try to answer as much as I can. Thank you so much guys, and keep working hard. You got this thing.